Good afternoon, everyone, and welcome to Vaccine Confidence Dialogues Online. My name is Rudy Page, and I'm pleased with this program. We shall be focusing on the community pharmacies, which of course are in all our neighbourhoods all around the country. But our selected pharmacists today will really focus on, or they come from Croydon and Southwest London, but also will have a special focus around the role of the diaspora in terms of vaccine confidence as well. So I'm pleased the High Commissioner for Jamaica is with us. And so we're going to get the show on the road. And I'd first of all like to turn to Amit. Good afternoon, Amit.
Good afternoon, Rudy, and thank you for having me. Hi, everyone. I'm Amit Patel, and I am CEO of the Croydon Local Pharmaceutical Committee, the Merton Sutton and Wandsworth Local Pharmaceutical Committee, and I'm also CEO of Pharmacy London. I'm very pleased to meet you all.
Thank you very much for that. So I'd really just like to start with you, Beran. So could you just tell us what your individual role is within community pharmacy?
Yeah, really. So hello, everyone. I am a pharmacist practicing within a small community pharmacy in the heart of the local community. That's in Thornton Heath. We have a very large patient base of patients from different walks of life. And we have been practicing or looking after pharmacy and our patients for the last 30 years.
Thanks for that. Thanks for that. So, Beran, starting with you, really, please explain the health and well-being role of community pharmacies for local communities within their neighbourhoods.
Right. The name itself, community pharmacy, speaks for itself in the sense that we are in the heart of the community. We are located right where the patients need access to healthcare. We are a trusted face in the local neighborhood. In terms of healthcare needs, in addition to the supply chain and the management of medication for our patients, we also provide additional services. These look at providing things like health checks for our community patients, looking at their cardiovascular needs. We look at smoking cessation, where there is commission services for that. We are doing new medication services. So this is a service where patients who are prescribed a new cardiovascular drug or a drug that fits into a certain close monitoring criteria, we will contact our patients within 2 weeks, 3 weeks, and see how they've coped with it. And based on that, adjust their speak to their prescriber to see if any doses need to be adjusted or address any that patients have or any side effects that have been picked up. There are a whole range of other services that have been commissioned, things like chlamydia screening, chlamydia treatment. We look at things like contraception, because again, access to GP surgeries has been very difficult, and community pharmacies placed in the heart of community provide that. Although a lot of the services are subject to commissioning by Croydon Council, and we are sort of constantly pushing them to commission more services and more facilities within Croydon.
Okay, thanks for that. So what is the unique role of community pharmacies across Croydon, Southwest London, within the NHS vaccine rollout programme itself?
So in Croydon, we have 2 pharmacies already providing the actual COVID vaccine. We have 2 more already upstream, just waiting for stocks to come through and starting off next month. And other services, other community pharmacies within Croydon will get commissioned further as the bigger centres start being decommissioned as they move on to the normal life. Like, for example, the Fairfield Hall site is going to be closed down soon. The Burley Hospital site will be closed down soon. So that capacity is going to be taken up by community pharmacy. In addition, the pharmacies that don't provide the actual COVID vaccine service our role is to signpost our patients, to advise, to address worries and anxieties. And all pharmacies in Croydon provide the free lateral flow test that patients can actually do at home, just for reassurance and make sure that we can get normality back.
Okay, thanks for that. Paula, I'd just like to turn to you now. How should people prepare themselves for the vaccine?
Thank you for inviting me. So in terms of preparing for the vaccine, really, and there's not much preparation, the most important thing is, getting the information that you need. So if you're listening to this live, that's the first step in the preparation, understanding the vaccine and why you actually are getting that vaccine. If you're unsure, pop into a community pharmacist, ask any questions about the vaccine. I would say that's the first step. But other than that, the vaccination centres are very well set up. It's usually a straight walk-in. You'll be greeted by, people welcoming you to the centre. Usually the vaccination is given in the upper part of the arm, so wear, accessible clothing, so that can help with your dignity and, your ease of access to the site of injection. When you get to the site of the vaccination site or to the vaccinator themselves, they'll ask you a few questions, and really to ensure that that vaccine is safe. If they need to give you any additional advice or ask further questions, and it's usually, are you well today? So if you've got any form of acute illness, it may not be possible to get the vaccine. Have you had a vaccination within the last 7 days? Are you pregnant? Are you on any blood thinning medication? Again, that's important. And I would ask whether you've been infected with coronavirus within recently. So if you have had a coronavirus infection within the last 28 days, then, if it's less than 28 days, you probably wouldn't be able to have the vaccination at that point. So we usually advise that people wait 28 days after an infection before you get the vaccination. And also they'll ask, what other medication you're on. So those are the general questions you'd be asked.
Thank you. And of course, you're based in Croydon as well, aren't you?
Yes, I'm based in Croydon, again, in the heart of the community, West Croydon, to be precise. And I suppose as our role in terms of healthcare providers, we've got, between us, we speak a combination of about 8 languages. Okay. So, communication in any language is not a barrier for us.
Excellent. I'd now like to turn to you, Ife. Good afternoon.
Hello. Right. So I'm a pharmacist. We're based in Newddington, Croydon. We're tucked away in a very remote part of Croydon. We have loads of people in the ethnic minority ranges. My role here as a pharmacist, like my colleagues have said, is I'm a trusted member of the NHS healthcare professionals. People coming here to us, our doors are always open, 24 hours for some people. In my case, we are open 12 hours a day. People coming to us without any appointments, we're trusted. They come in for any problems at all, ranging from baby cares to concerns about vaccines, contraception, blood pressure, anything, side effects to things, we're there for them. And we are always here to allay their fears.
So when somebody walks in and says, is the vaccine safe? What do you say?
Oh, there's always a lot to say. And we've got, for any vaccine to be out there, it has to be safe and effective. It's gone through the phases that has been very vigorous phases that has been approved in this country by the MHRA, which is the organization that overlooks the production of these vaccines. So we reassure them that it's been passed for it's gone through the lab tests, go through humans, it's assured that it's safe and effective, and then it's passed on to the human stage. And when it gets there, it's tried on sometimes between 5,000 and 40,000 people. And in this case of the vaccine, it's even been tried in different countries. Right. So it's been tried on blacks, whites, all sorts, everybody in different parts of the world, and has been assured as safe and effective. Okay. Before being tried on people. So we assure people that it's safe. Yeah.
Right. Okay. Thanks for that. And Baron, I'd really like to come back to now before I bring in High Commissioner and other members of the diaspora. Is so can you reassure people who are refugees or maybe unsure of their status due to the Windrush that their details will not be shared with the Home Office, local authority, or any other agency?
Yeah, really. I mean, our patients obviously get access to the healthcare. In terms of COVID vaccines, they're all entitled to COVID vaccines. The data is held at the centers or by their GPs, and that data is subject to data protection. So the GPs will hold that data within their unit, and it's not given out to any other organization. So in that purpose, there should be reassurance that they are protected.
Okay, thank you very much for that. And David, I'd like to turn to yourself as member of the Home Office Windrush team around the reassurance question.
Yeah,
thanks to the Windrush people.
Yeah, thank you. Again, thank you for having me, Rudy. Yeah, our position in terms of the Home Office is quite clear. The primary issue around this is the importance of getting the vaccine and making it as available as much as possible. Everything in terms of primary medical care, in terms of where you go to surgery to get the vaccine, that service is, because it's primary, it's free of charge, and that's irrespective of immigration status. So the vaccine would be free to anybody with or without status. And because that is the case, there are no immigration status checks which are carried out. So there's a link here in terms of the same kind of message we try to state when trying to engage people who have reservations about the Windrush scandal. People were very much concerned that if we were inviting people to meetings and they turned up, that they would be subject to enforcement action. That does not happen, and it's the same thing with the administration of the coronavirus vaccine. The enforcement services have no involvement in this at all. So anybody, regardless of their status, can receive the vaccination without any worries or concerns about their status. That's the Home Office, but that's the position.
Right. Thank you.
Primary issue here is to ensure people receive the vaccination.
Thank you very much for that, and that's very clear. And I'd now like to come to High Commissioner Ramocan, just to be able to say a few words of reassurance as well. Thank you.
Thank you very much, Rudy, and I'm very appreciative of the invitation to be here with you today and to be present with, quite a number of pharmacists and other professionals who are online with you. And of course, you are linked into Facebook, which means there is quite a population out there that will be listening. And we couldn't today be dealing with a more important subject than that of trying to find ways and means of helping those who might be somewhat reserved about going to take the vaccines, to encourage them to do so and to make them aware of the facilities that are available to them such as the pharmacies, a community pharmacy, together. I don't think many persons were aware of this. You know, the availability, I don't think there's been so much publicity of it, and therefore the role you're playing today is very important, very critical, because there is hardly, you know, you could hardly walk a mile in any one of the city areas and not come across pharmacy. It's right there, it's right beside you. And what is important is that it is not intruding upon who you are and all these details, which means that any fear that one might have can be allayed by the confidence that really surrounds this program. I really want to say to the community out there that vaccines are an extremely scarce thing worldwide. We are here talking about, you know, going to take vaccines and so on. There are so many places on the globe, including in Jamaica, that people are wanting, they are anxiously awaiting the arrival of vaccines in order to have one. And, you know, I just can't help but reflect on a country like India that had, you know, you could say a surplus. They were producing vaccines at a high rate, to the extent that they were helping countries, you know, less developed countries without vaccines by sending them some kind of a shipment. Now India has to reserve all of what it has, is not producing enough because of the outbreak there. And an outbreak is something that can happen anywhere. It was very high here in the United Kingdom, and it is pretty high in other parts of Europe. And I want to urge everyone to know that this is an opportunity. It's not something to take for granted. What if tomorrow you may hear that there is a major outbreak, and so the vaccines have gone short, and you just can't get close to one? You can now get that right within your community. And that's something to learn to appreciate, because sometimes when things are too accessible or convenient, we tend to take it for granted. And I just don't want us to do that. So I want to commend the team. I want to commend you, the organizers of this discussion, to on the foresight that you have had, the generosity of spirit, the voluntary spirit of wanting to put something like this on, because saving lives is really the key to all of this vaccination program. It's not a matter of wanting to just have vaccines and not being able to, you know, not being able to get it. Your problem is making use of what you have. And so I want to commend to all who are listening that you should make use of this opportunity. It is one that is very, very scarce. I wish I could be sitting in Jamaica, you know, hearing that, you know, all our pharmacies are sufficiently equipped with vaccines and people just go there. It's not so. And that's for the majority of locations, of countries across the world. So make use of it while it's available. Thank you very much.
Thank you very much for that, High Commissioner. Amit, did you have your hand up for a moment there?
I was actually clapping the very powerful words of the High Commissioner. It was really good. But I would like to add, as well as having the vaccine, what's really, really important is the testing program.
Yes.
You can go to any pharmacy and collect tests. When there are surges and new variants, our public health teams are looking at having tests that can pick out the South African variant, the Indian variant within pharmacy. This is free and with the minimum amount of questions asked, because what we want to do is roll it out to everyone and have it available for everyone with no barriers.
And that's every pharmacy in the country as well, isn't it?
More than 90% of pharmacies.
90%. So 90% of community pharmacies, which are in everybody's neighborhoods, regardless of where you live. That in itself talks about a universal service. That's what it means, isn't it?
Absolutely.
Great, great, great. Right, we're now going to, thanks for that. We're now going to, we've got members of the diaspora here. So I'd like to call Wade Lynn, who's the...
If I may be permitted, Chair, I'm so sorry.
Yes.
My next appointment is just
All right,
off
of
now,
course.
so I'm going to be running. Thank you ever so much. Have a wonderful, wonderful discussion. Goodbye.
Thank you for your participation, High Commissioner.
Yes, you're welcome.
Most
Thank
valuable.
you.
Thank you. So our honorary counsel for the West Midlands. So Wade, great that you're here.
Yeah, thank you for inviting me today, Rudy, to give a short speech. You are correct. Some pharmacies in the Midlands, well, I'm from Birmingham in particular, you are big enough in the sense that you have an in and out entrance and exit. You can actually do the testing, so you can actually walk in to actually get the testing done. I think the main concern from the diaspora is obviously the fake news, which you can understand. But I just need to add something to the pharmacy, that if a third of the population may have COVID symptoms but are asymptomatic.
Yeah.
Now the question sometimes may be asked, if you're asymptomatic and you do turn up for a vaccine, and you may not know you're asymptomatic, but you are given the vaccine, will that push you over the edge so that, you know, you could have blood clots or whatever? I know that situation is 1 in 100,000. Let's get it clear. So that the 1 in 100,000 may mean that you could have a car accident if you're one of those persons, 1 in 100,000. But from my aspect, I am actively promoting that people in our community, the Afro-Caribbean community and the BAME community, to take the vaccine. And I think the main issue, as I say, it's not about getting the vaccine, it's about the false rumours on the WhatsApp. And I think that
misinformation.
is critical. I'm aware that the volume of vaccine coming into the UK from India has had to reduce because, one, they've had a fire in one of their plants, and two, they have to use the bulk of the vaccine for their own country now. They did sign an agreement with the World Health Organization that they would supply 70% of the production to the rest of the world, but now they've got a pandemic, it's only down to 50%. And the UK has taken vaccines from obviously India as well. So from my aspect, I try and promote as much as possible. Take the vaccine. If you are unlucky to be at 1 in 100,000, then to have a severe problem with it. But the issue you've got, you sound 1 in 10,000 of getting ill if you don't take the vaccine. But going forward, it's the asymptomatic people that will be the transmission per people that will transmit. But also the young people, let's get it clear that the children that go to school, they will also carry and don't have major symptoms.
Right. Thank you. Do one of our clinicians want to answer the first point that Wade made around the people who are asymptomatic? Baron, Bolo, Ife?
Really, so there are sort of minor cases that are coming across, but all in all, majority of patients, so well over a substantial percentage, do not get any symptoms or side effects from it. The issue with regards to the clotting is quite a very small percentage of cases, and it's monitored closely.
Okay. All right. Thank you for that. I'd now like to come to Dr. Beverly Lindsay, who's representing the Association of Jamaicans, because we're on here, as mentioned earlier on, we've got our diaspora trusted messengers, and just going to talk about some of the work they've been doing in the community up until now.
Good afternoon, everyone, and thank you for having me, Rudy. As you know, my name is Beverly Lindsay. I'm in Birmingham. I'm a businesswoman, proprietor of Diamond Travel. I'm chair of the Association of Jamaican Nationals. Also, I am a Deputy Lieutenant and former Vice Lord Lieutenant of the West Midlands. You know, having lost members of my family and many friends through COVID-19, I do everything in my power to encourage the uptake of the vaccine. You know, I don't know why most of us are hesitant, because we've been taking vaccine all our lives. In children, you know, if you look at the left arm, there's little scars are there. You know, which I'm old enough to remember as a child back in Jamaica, you know, we were anxious to take it. I'm old enough to remember polio, when, you know, a lot of the children had polio and you know, some died and some, you know, became disabled. I remember going to school with children in calipers, and, you know, we were very happy to take the thing under our tongue, or the sugar lump. So we've been taking vaccine all our lives. Many people have been taking the flu jabs. And those same people are saying, I'm not taking the vaccine. I cannot understand, you know, through the lieutenancy, I've made a few videos which have gone, you know, shared widely. And, you know, that, you know, every death, as I say, is one too many. And we can't even bury our people as we used to, give them the send-off we used to. So I encourage each and every one to really take up this vaccine. I've had my two, and I'm still here. And, you know, talking about the negative things on the WhatsApp, my mother is 96 and she's more WhatsApp savvy than me. She spent more time. And she listened to all the negative news about WhatsApp and about the vaccine. And she decided she wasn't going to take hers. And then when I had mine, you know, and I called her the first day and said, well, I've had my vaccine. And she said, well, it's just the first day. You know, you're not sure yet. But a few days later, she called me, and are you still okay? And yes, so she's taking hers.
Yeah. Cool.
And so sometimes people just want to be encouraged.
Yes.
And, you know, it's not, you know, if it's not going to kill you, it might make you better. And, you know, I say too that you'll sooner die from COVID-19 than a blood clot. Yeah. I've had blood clot, you know, and caught early, and I'm here. You know, I was lucky, but, you know, I've had it. I had to be on warfarin for several months, but I've had it and I'm here. Maybe if I had COVID with my underlying health issues, I would not be here. So I encourage everyone to take it. And my local church, the New Testament Church of God in Lozells, Handsworth, in Lozells, Birmingham, is now a vaccine outlet. So please, everyone, you know, save yourself, as I said, you know, and protect your family. Take the vaccine. I've had that too, and I'm here.
Thank you very much. I'd like to bring Orin Lewis in now, ACLT. And Orin's done a lot of work in terms of supporting the community, particularly in the area of sickle cell. And,
good afternoon, Rudy.
Thank you.
Hi, everyone. Yeah, we're the ACLT, the African Caribbean Leukemia Trust. We're based in the heart of Thornton Heath. And I echo what's being said and viewed about the need to keep the emphasis on promoting the need for people of all races, especially those of ethnic minorities, to step forward and really, you know, seriously consider taking the vaccine jab, because we're getting into some very dangerous times right now as the roadmap evolves going forward, that there's going to be isolation sort of status of those, especially those from the Black community, if they are not part of the potential solution of the vaccine, and rather being part of the problem of being prone to getting, you know, a high risk of getting the virus. And it's worrying. I'm looking on another screen here, and I'm looking at the stats up to the 7th of April, the official Public Health England stats of who's actually taking the jab. And out of the 32 million that it's showing, you know, less than 650,000 of those are Black. it is really, really worrying when you look at the stats. You know, if you put in percentage terms, it's anything between 61% and 63% of African or Caribbean or Black British, those three categories. And so you start to wonder what's going to happen when we get back to some sort of normality in May and officially in the 21st of June. Those individuals, especially young people, but the stats on young people, young black people, is chronically low. So it means that they're thinking that they're immune because of their age. But we know they're leaving themselves prone to getting the virus. And then, of course, lifestyle is going to be affected, because there's no doubt about it. Some sort of certification and passport is coming out, which means that it's going to stop people doing things that they used to take for granted, especially traveling abroad. That's going to change. Is a big changer. You know, the ACOT, we are continually with yourselves to highlighting that people need to get on board, doing webinars like this, promoting it, because the stakes are very high, and the blame game is literally just around the corner. We know what's going to happen there.
Yeah.
If we're not part of the solution, the wider community is going to turn on us as a community, and we will then turn on ourselves, because some of us have been vaccinated and some of us haven't, and we're going to get back to the status quo of divide and rule.
Okay, thanks for that. There's some very key points in there. I'd like to bring Tony Kelly, being based in Birmingham, from Jamaica Diaspora UK. Tony.
So I'm no longer muted. Hi, as Rudy just said, thanks for having me. I'm Tony Kelly. I'm the Secretary of the Jamaica Diaspora UK West Midlands region, and also wear another hat in terms of a diabetes ambassador, have been for the last 9 years all over the world, getting people to look at health and well-being in relation to diabetes. I have type 2 diabetes myself. I've had it for 18 years. I've never taken medication of any description whatsoever. Physical activity and diet are my two key things. And every year without fail, I have the winter flu jab. So pro-social modeling is I get out there in communities and say, I've had the winter flu jab every year and it has done me no harm. With my type 2 diabetes, it is said I should have it, so I have it. Myself and my wife have had our first vaccination, and our next one is due on Monday coming at 2:08 at our local surgery. The issue for me, though, within all of this is, because Wade Lynn, who I know very well, and quite a few other people on this webinar today, sent me the link about the access for the vaccine to undocumented people. I've read it. I come from a background teaching English language and English literature in the high schools in Jamaica, went to Michael Teachers College. As it stands at the moment, this thing, which Wade has sent out, which came from the Nishcam Center and came further afield from the somebody in the ministry, etc. What I want us to do going forward is have a bullet points on an A4 or what, the small size thing.
Yeah.
And the same way WhatsApp is, people are sending out this, that, and the other WhatsApp, this, that. It needs to be done in a format, bullet points, very, very simple. So undocumented people, whether they're asylum seekers, political people, refugees, undocumented or what, they can get this and they will realize, oh, okay, I didn't realize, I was so fearful, I was so scared. If I go into a community pharmacy or if I go into, I'm going to be hauled in. That is still, we now know that. The people out there need to get that message. And the only way to get that message out there to all and sundry is to do a very nice, simple, basic, fundamental, effective flyer, so that people are aware they can go into a community pharmacy, they can go here, there, or what. This, as it stands at the moment, I'm afraid it doesn't do it for Joe Bloggs and Mary Smith out there. I'll end there.
Thank you for that. And that's why we're here today. And
so who's going to take that on board? Who's Rudy? Who's going to follow through with that? Because I'm not into the
I'm just
talking,
explaining.
I'm doing.
I'm just explaining.
Okay.
That's exactly why we're here today. and why we've got the community pharmacists. Yes, it's in Croydon, but what we want, it's what the community pharmacists wanted the community to understand. You can go into any of your local community pharmacies in all the major towns and cities where the African and Caribbean population groups reside and beyond. And through Croydon, that they've undertaken to do this piece of work within the system. And we've shared the ideas already with other colleagues in the vaccine equality team in NHS England. Bola and Ife, in fact, were also on Africans in London TV a couple of weeks ago, again, setting out very clearly the importance of your local community pharmacists. And that's why, you know, we see them as trusted professionals. They never closed at all throughout the whole of the pandemic as well. People will see that from their local pharmacists. So they certainly are people who can be trusted. So yes.
So can I then just get a timeline for when I'll be able,
well,
somebody will be able to say, yes, we're going to send this to you, Tony, bombard your 2,000-3,000 people you have with this.
Don't worry, Tony. You wouldn't be sitting here. You wouldn't be sitting here if there wasn't a
follow through,
a clear follow-up to be taken on
TBC.
Okay, thank you very much. The other thing as well, Bola, I believe both you and Ife have patients from your pharmacy. So,
and when I spoke to her about this, she was quite eager to come and share her experience of using her trusted pharmacy. Yeah, so over to you, Mr. Hogan.
Thank you. Thanks. Just to first thank Ife, because I think she's been a great pharmacist, you know, over the years. We've been here over 12 years, and Fieldway had been here for about 10 years, if I remember. And it came as sort of a saving grace to myself and my family. My greatest thanks goes to the time that I had my daughter, my first daughter, that had serious issues with her skin, and she was asthmatic. And we've had the saving grace of Fieldway, you know, pharmacy to sort of, when the doctors could not help us or there's no one to see us, they would say, you know what, you need to do this and that, and straight away do this. There were times that we've been directed to NE straight away just because we've seen her. So it's shown great support to us, great support. I mean, for the other children I have who all have asthma, she has been very supportive to us. So yes, it's great to have it around. I mean, for 2 years, we didn't have her around, so it wasn't great, but yeah, in the last 10 years, I'll say we're very grateful. Thank you.
All right, thanks for that testimony. When your patient arrives, then we can hear from them.
Thank you very much, Rudy, and thank you to the conveners of this very important discussion about vaccine confidence. I think it's a really important conversation to have, because I was initially quite hesitant about taking the vaccine myself. But because I have been a customer of Fieldway Pharmacy for quite a few years, I was able to talk directly with the pharmacists there, and they allayed my fears in a sentence. I was concerned because I hadn't had the flu vaccine ever in my life. I didn't think it was necessary, as I've never had the flu either, to the best of my knowledge. But then when they found out, or not they found out, they've known that my husband is clinically extremely vulnerable, and they know some of the other health issues because they are my family's pharmacists, Fieldway. So when they found out about this, they were able to give me what I might call targeted advice and also reassurance as to why I should have the vaccine, as to why I should also ensure that my husband had the vaccine as well, and the benefits that it would confer on both of us. And I have to say that since taking the vaccine, even though we have been shielding, even when we were not meant to be shielding, you know, it's really enhanced my confidence moving around in public. I do know that it doesn't mean that we are no longer at risk. I do know there's still risks after the vaccine. I know this mainly because of the excellent information that has been provided to me by Fieldway. So as a result of that, I too have circulated the obligatory WhatsApp photographs of taking the vaccine. And I've also been able to have a stock of lateral flow tests as well. Fieldway provided me with that, so that if I need to go anywhere and want to reassure myself that I'm not exposing my husband to any infection, I'm able to do so. So I think I support the message that the pharmacists are really, really helpful in the community. And I can say that based on my experience of Fieldway Pharmacy, Newddington in Croydon. Thank you.
Excellent, excellent. Not much more can be said after such a great testimony to you, Ife, and your staff. Very well done. Right. I think what we're going to do, if there's any other points of clarification or any additional points anybody wants to raise before I come to Dave, as we just come into the end of the program. Right. Yes, Orin.
I just want to ask the pharmacists
Yeah.
out there, have they noticed a particular change in the dynamics of the conversations that you're having with your regular, not to say clients, but the people that come to you on a regular basis who for prescriptions, repeat prescriptions, the conversations that you might be having before COVID and since the vaccine came out, has the dynamics changed? Is it more reticent, or are you feeling that you're able to get across the high levels of trust that you impart out there? Is that making a difference? I just want to sort of throw that question out there because I'm just wondering, on the high street behind me, there's a couple of chemists there, and I'll be interested to see going past, what is it similar to what you're seeing?
Yeah, that's a good question for all three of you as pharmacists at the front line. Yeah.
I could go first if that's all right. So I think during the height of the pandemic, what we found is that we had more men coming into the pharmacy than we've ever seen before, of all ages. And that is a challenging group of people that we know sort of are reluctant or were reluctant to seek healthcare. And so that was really, really encouraging to see more men coming into the pharmacy. What we also noticed was that there were more people of all ages taking more responsibility for their own healthcare, so what we refer to as self-care, asking various questions about how to treat various or manage various types of conditions, and also whether they should have, certain tests done. It was just being proactive about their healthcare. A particular conversation I had with a patient, she asked me, she's sort of, I think she was maybe in her 60s, and she had all these concerns about getting the vaccine. Each time she asked a question, I answered it, and she came up with another question. And so just understanding where she was coming from, acknowledging her fears, I asked if she knew anyone who had suffered from the coronavirus infection. And she said, yeah. And I said, so which one would you rather have, the corona infection itself or the vaccine? And she paused. She understood it from a different point of view. And that was enough information for her to go away with. So in conclusion, we are able to meet people where they are and be able to have a conversation at a level that they're comfortable with.
Thanks for that, Baron.
When we first started the sort of COVID pandemic, there was quite a lot of apprehension out there. But the fact that we were open and easily accessible, and patients could come in and allay any of their fears from us. They couldn't get access to surgeries at that point, and well, they still can't. But at least they could come in and talk to the pharmacist, and we reassured them. And we've seen a trend now, and people now come in with respect, that we stood by them and supported them through this. And it wasn't just COVID, but there were other, COVID was just one part of the health management. I mean, all the other diseases didn't disappear. All the other diseases are still there, and we're living with that and COVID. And to be able to help and support our patients through that, I mean, it's amazing. People now really come in with a lot of respect and a lot of understanding of how we supported them.
Thanks for that. Ife?
Right, so here in Newddington is a small community. Everybody knows everybody, kind of. So when this COVID started, at the height of it, as we know, a lot of ethnic minority people were really affected. And being in Newddington, people instantly knew who had died or who lost somebody. So there was a lot of fear in the community. And where was the natural place to go to? The community pharmacy. So we had a lot of people coming to ask questions because they were really scared. So we were updating ourselves really quickly so we could have accurate information to pass on to our patients. People were coming in, asking us about what to do. So we found people buying multivitamins. Some people were even coming in. You know how what you get on social media, false information, they were coming straight to us. So all our staff had to be updated with the right information as well. So people were coming in, should I do this? I heard if I drink this, I heard if I take salt, we had to allay their fears. Yes, we had things. In fact, people come to us now and say to us, they'll just walk into the consultation, I want to speak to you. They tell you about something, that lady there, she died. What do I do? Can I talk to her? Can I talk to the children? Weeks after, am I able to speak to the children? Will I get it 4 weeks after? And you tell them, you reassure them. We've been hit badly in Croydon, and we've also had people coming to ask us about what to do about people back home, information. So we've had to give them information, like pass on information, what's your number, pass it on to them, and they also share it with their families back home. We've had loads of to give us feedback about vaccine now. And also, very important, I've had people who have come in here to say to us, why are you not giving us the vaccine? These are people we convinced in the past to take the flu jab. Pharmacies give flu jabs. We've played a major part to convince people to take flu jabs. So some of them come to us now and say to us, I would like to have my COVID jab from you because they trust us.
Yes.
Can I just add one very small point before you close up? Now, we have around 70 community pharmacies in Croydon, around 150 in Merton, Sutton, Wandsworth, around 11,000 in the country, and I know you're from all around the country. Our community pharmacies reflect the communities that they live in. Community pharmacy staff are made up of the communities that they're set in. So your friends, your family make up community pharmacies. What's been a real shame is healthcare workers weren't put at the front whilst they were out there delivering all day, every day. We have had community pharmacy staff who have been hesitant. We've had community pharmacy staff who have got ill, who have died, who have had parents die because they've brought it back home. We have gone through exactly the same cycle that our communities are going through. We've had the same conversations within ourselves and we've had to deal with the same issues. And this is why our pharmacy staff are really, really well placed to talk to our communities and the people that need it.
Right. Okay. Right. I'm going to have to leave it there, folks, because we've got our last contributor, and that's Dave, the international poet. Dave, over to you.
Thank you, Rudy, for inviting me today. Nice to see you all. My name is Dave Wilkes, international poet from Birmingham, and I was asked to write a very bespoke poem about the vaccine. So I've completed the task, as it were, and do you mind if I share it with you today?
Yes, please.
Okay, then, thank you very much. So I've titled this poem, The NHS Vaccine Solution. To every situation, there's always a solution. And taking the vaccination through the NHS is the main solution to this current virus situation. Refrain yourself from twiddling your thumbs and saying, I'll wait. This vaccine solution will help you. Please don't hesitate. What a feeling from within, knowing that by taking the vaccine, you could have saved somebody's life. A son, a daughter, someone's husband, someone's wife. The greatest gift from above is your life, please remember. And please refrain from the stress of the mind and this vaccine propaganda. Jokes are connected to laughter, and this virus is no laughing matter. COVID is real. How does this make you feel? Taking the vaccine truly opens up so many choices and opportunities. Like before 2020, where there was collaboration in our beautiful communities. Every single person is valuable around us. So please, let's not bring risk to people of any age, especially the wisdom of our elders. There's millions of people around the world who've taken the vaccine and they feel fab. And I'm blessed with peace of mind because I took the jab.
Thank you very much. Thank you very much for that, Dave. And I'd like to thank you all very much for attending this Vaccine Confidence Dialogue today and our focus on community pharmacy. And as you've heard, that there's a pharmacy in everybody's neighborhoods. So please support your local community pharmacy because they are part of your community as well. Thank you and good evening and stay safe. Bye.